is John Mollaun, Executive Director of Hope Healthcare Services in Avon, Indiana, which is a suburb of Indianapolis, Indiana, just on the west side. I appreciate you sharing already, why you're here and who you are. I want to, first of all, talk about CCHF. I owe a lot to CCHF. One of the reasons that I wanted to present is, Lord willing, I've got a retirement date of September 30th this year, so I preface everything with Lord willing on that, as we should. But I wanted to give back at least something, and last year I didn't feel like there were many sessions for smaller clinics. I don't think that was an oversight or anything, I didn't see that. So I thought, hey, if there's anything I can share that somebody could learn from, boy, that would just be a great way to at least me to try to pay back in some way. But I'm still here to learn, believe me. The one thing I love about CCHF in the years that I've come, they never told me what to do. And I don't think I can tell you what to do. We're in a suburban area. Some of you may be rural, you're urban. We're medical, dental, and mental health. We are a charitable clinic. We do charge a fee. We'll talk more about kind of our clinic and our experience, but you're maybe in a different situation. So it's not cookie cutter, and John can tell you that as well. John Mills here, who was CCHF and helping clinics get started. So it's not like I have a recipe here for you. Hopefully you've taken the title as tongue-in-cheek that it's supposed to be, and that I don't perfectly run a small charitable clinic. But what I did get out of CCHF is I did get some ideas. I did get great encouragement. I did get teaching. I did get inspiration. And I did get input from other attendees. So it's very, very valuable. But again, nobody's going to just say, hey, here's the piece of paper and here's how you do it. In fact, I think when you come to a conference like this, one of the problems is you're going to get 50 good ideas. And you can implement 2 or 3, hopefully. Keep the 50 good ideas. Keep them on a list, keep them, pray over them, stay with them, but know that you should prioritize 2 or 3 things. And if you've got more than one staff person here, get together, figure out what those 2 or 3 things are, and then move forward with them. And if you get those accomplished, fantastic. Then move on to the next one. So even, 10 or 12 ideas is too many to really implement. So with that, we'll start with a quote from The Hobbit. It says, "The prophecies of old turned out to be true after a fashion," said Bilbo. "Of course," said Gandalf, "and why should they not prove to be true? Surely you don't disbelieve the prophecies because you had a hand in bringing them about yourself. You don't really suppose, do you, that all your adventures and escapes were managed by mere luck, just for your sole benefit? You're a very fine person, Mr. Baggins, and I'm very fond of you, but you're only quite a little fellow in a wide world after all." Well, if you want an introduction of me, I'm a very little fellow in a very wide world, okay? And that's, my background is I was a math major at Indiana University. And I worked for 26 years for an electric utility. In fact, it merged with Cincinnati Gas and Electric, and if you look across the Ohio River, I can see the Cincinnati Gas and Electric building that used to headquarters the company I worked for. It eventually merged and became Duke Energy, and when Duke Energy merged, I took a voluntary severance and left. In 2004, this clinic was started by the church I attend, and I thought, this is the greatest thing this church has ever done. Now, that was my opinion. It may not be according to what God looks at. But the reason was, it was because it was explicitly about everybody else in the community. It wasn't to get discounted health care for our church members. So I thought, this is fantastic. This is the church. So I actually applied for the job when they went out in 2004. And at that time, the merger had not happened with Duke Energy. So if I ever left, and there was always rumors that we were going to merge, I wanted to leave with a severance package. Okay, how honest is that? And so when I went and interviewed for the executive director position in 2004, I came home from the interview and my wife said, "How'd you do?" And I said, "I wouldn't hire me." And they didn't. I had great passion for the mission, and I wanted a severance package. And I had one foot in and I had one foot out, what James might call double-minded. And they didn't hire me, and I think that was a good thing. Well, in March of 2006, they did merge, they merged. I did not know, or in May, in March of 2006, they had fired the executive director. I did not know that. And from March until December, they went with no employees, just volunteers. So finally, in the fourth quarter of 2006, they decided we probably ought to have an employee or two. So they went out for an executive director. And because, again, I had been 9 months now untethered from Duke Energy, I didn't interview. Because of the problems, whatever they were with the first executive director, I don't know what they were, and I've never asked. They wanted someone with 10 years progressive experience in nonprofits and a master's degree. I have neither. I had zero experience in nonprofits and a bachelor's degree in math, so I didn't apply for the job. They had 25 qualified candidates. They were narrowing it down to their final candidates, and somebody on that committee had remembered that I had applied for the job 2 years earlier. So they called me up and they said, "Are you interested in the job?" And I said, "I've read your qualifications and I don't qualify." They said, "Well, put your hat in the ring." So I interviewed for the job and they hired me. So I applied for the job and I didn't get it. I didn't apply for the job and I got it. So that's how you know God's in it. So I am quite a very little fellow in a very big world. And the other thing I did, so it's not me, okay? I do want you to understand that. Praise God, it's not me. I would love to take credit for what goes on at Hope Healthcare Services, but I could tell you stories and you go, "What did you have to do with that?" And I said, "Not a thing. It's just God does great work." Excuse me. One of the first things they did, in fact, I started January 2nd. The first is a holiday. So I started January 2nd, and one of our board members was employed at another nonprofit. It was a domestic violence shelter, Christian, and she took me to meet the executive director there, which was great. I needed that. I did talk to other executive directors. So I went, pen, notebook in hand, sat down with her and said, "What do I need to know?" And the first thing she said was, "Pray." And I wrote that down, and I'm type A, I'm a math major. I said, "Great, all right, let's get to the important stuff, right? What do we do here?" And she gave me the right advice. And we'll talk about prayer here in a bit, but, we prayed before this session. We pray that hopefully the right people are here. I pray that, I don't get in God's way here. And somehow, I give you something that you can take home. If you've never read Atomic Habits, it's a great book. James Clear is the author. And here's what he said. He said, "Enough courage to get started, plus enough sense to focus on something you're naturally suited for, plus enough persistence to stay in the game long enough to catch a few lucky breaks, and a lot of hard work. There's your recipe." Amen. So when I read that, I agree with that and all of those. First of all, if you are starting, I'll tell you now, it's going to be hard work. And many people have said that, and they'll probably say it again. And the key is, and I believe I'm called to work and work hard, but I work and I work and I work and I work and I work, and then God brings it up over here. And I'm amazed, but it's also humbling, because it's like, what am I doing over here? But it's good. And again, I believe we're called to work. I look at my job largely, two things. I've always said my job description. I don't see patients. So my job, in my opinion, is to get everybody else what they need to do their job. That's the way I look at one of the first things we needed is a new building. I'll show you pictures of the building here in a second. If it's equipment, if it's staff, if it's money, if it's whatever resources, that's the way I look at my job. Now, people may differ. Again, all I can tell you is my experience and what I've done. There's books and stuff that I'm sure will give you maybe better advice. The other thing I look at my job is planting seeds. And I can control that. I can't control the harvest. I can't always control the watering. But I can control how many seeds I plant. So I focus my attention on how many seeds I can plant. Now, we only, we have two people on the non-clinical side. Myself as executive director, and I have a part-time bookkeeper assistant for 15 hours a week. which means I do anything non-clinical. So I'm raising the funds, and I'm the legal department, and I'm the HR department, and I'm the, I take out the trash. So it's, that's what I do. Anything that needs to be done, but again, it's all in the context of what does everybody else need? What does the clinic need to serve the patients? And so that's where I look. So that means you wear a lot of hats. And the other thing I'll touch on briefly is be careful how you measure success. I'll give you an example. There was the north side of Indianapolis is the wealthiest area of Indianapolis. We're on the west side. Okay, we're not poor over on the west side, but we don't come close to the north side. Well, the north side had a thing, they called it Connect the Docs, D-O-C-S, where all the doctors would come in from the areas, and there were all the vendors there that wanted to sell them things, and so the docs would go, and they would, just an open house, and there's wine and cheese and whatever, and way off in the corner are places that the doctors could volunteer. I mean, way off in the corner. Well, interestingly enough, most of the doctors and dentists live on the north side of Indianapolis. So I'm right there next to two north side of Indianapolis clinics. Well, guess where they want to volunteer? And I don't blame them. They want to volunteer in their community, close to home, quicker commute. I completely understand it. So I went to this for 4 years. In 4 years, I got one volunteer. Okay, now was that a success? Got one volunteer. Well, here's what happened. She happened to live on the west side. So she found us in this 4-year period. I got one volunteer. This was an evening. I had to pack everything up. I had to set up the table. I had to do all that good stuff. Well, she invited her best friend to come volunteer with her, who was a physician, who invited her husband, who's a physician, who invited their friend, who's a physician, who invited his wife, who's a physician. 2 of them ended up to be board members. Was it a success? Be careful how you measure success. What the seeds you plant, you just don't know. Now, again, you have to use some discernment if you're really just running down a road that's not going to bear fruit. But you don't always know, and that's a big key. So what do we have next? That was our building. And we were formed under the name Kingsway Community Care Center. Kingsway is the name of the church. That is a house that Sears used to sell. Sears and Roebuck. Google it, okay, if you're under 45. And that is 2 railroad cars with a bunch of boards slapped in between. And if you actually went in the basement, which was about this tall, you could still see the railroad car undercarriages hanging under it. The front porch was our waiting area. There's 7 large, great big parking spaces there. It was 1,200 square feet. We had 2 medical exam rooms and 1 dental operatory. I hired 2 people to work there, a clinical manager and a bookkeeper. And so there was not space for me to work there. So I always knew my job was out in the community. So it reminded me of that. So I didn't even, I was there a lot, but I didn't work there. I didn't have an office there. I didn't have a desk there. The first thing I realized is we needed a new building. Okay, the floors were uneven. The basement had standing water in it. People came there and got sick, okay, which is great for, your long-term stability, right? But maybe not so much as a ministry. So we hoped and we prayed and we thought, we put out a plan. We hoped to go from 1,200 square feet, which we were renting, to 2,500 square feet renting. So I'm working with all these different realtors and all these people to possibly somehow get 2,500 square feet. We had already drawn out the plans and everything, just if we could rent 2,500 square feet. Well, God brought us a 4,000 square foot building that we own, okay? We still have a mortgage on it. It's our only debt, and it's about $100,000 right now that is left on it. But again, just to give you some background on where we came between the two, it began with one church. The church every year, the senior minister did a vision sermon, so to speak. And part of that vision sermon was a community care center. And it was going to have legal services and maybe a food pantry and clothing ministry or things like that. Well, finally, one of the doctors in the congregation approached the congregation about starting a medical clinic. I don't think he'd ever heard the vision sermon, but here was a large, prominent church with a doctor who was willing to start a clinic. So they did some research, and they began to find out, is there a need in the community? There was a need in the community. And then an oral surgeon heard about it, so he wanted it to be a dental clinic as well. So that was all around 2003. Then, and one of the things I'll tell you, if you are looking to start a clinic, one of the best advice that I've given people, look around you, and if there's already a clinic in the area, go to them and find out how you can help them. Now, if God's calling you to do it, I'm not telling you not to. But what's going to happen is you'll compete for the same volunteers, you'll compete for the same dollars. And we had a large church in the area after several years come to us and say, listen, we'd like to start a clinic. They had been doing, turning around a room in the church for a long time, or several months. When they came to us and they said, listen, we want to start a clinic. I told them two things. I said, number one, I will help you in any way that I possibly can. I'll do everything I can to help you. Number two, don't do it. Join us. We're not at capacity. I said the first thing you're going to need is an executive director. I'm the largest item on the budget, and I don't see any patients. The second thing you need is going to be a building. That's the second largest thing on and you know what? That doesn't see any patients. And you know what they did? They did exactly that. They came and joined us, got some board members there, had another active church. I said, hey, if we outgrow this place, yes, let's start another clinic. Now again, if they would, and I was very sincere about point number one, had they wanted to start their own clinic, I would have done everything I could within my power to help them and given them anything that I had that I could send their way. Well, we were incorporated in 2004. We opened the doors in June of 2005. 2008, 2009, we bought the building. We bought it in September 2008. It was a laundromat and tan. And so we converted it into a dental clinic. By February, we were open as a medical dental clinic. It's, again, 4,000 square feet. It's got 3 dental operatories now, counseling room, 4 medical exam rooms, and some other spaces too as well. You got an office in there? You know what? I work out of the conference room. So with a big sign over my PC that says, if you can read this, you're not out seeing donors. So that's... I
can't reinforce enough what you were describing about your role, which is not to be in the weeds managing the operation, but is to be out in the community, telling your story, building relationships, finding them.
Thank you. But yeah, I praise God, I stumbled on all this and learned from others. In 2015, we changed our name to Hope Healthcare Services, not for any dissatisfaction or dissolution with the church, okay? Here's what happened. The church is a very prominent church. Patients showed up at the church. We were never located at the church. I showed you our 2 locations. Volunteers showed up at the church. Patients called the next day. Showed your appointment. No, I didn't. I knocked on the door for half an hour. Nobody answered. So people assumed in the community that the church paid all of the bills because it was under their name. Also, community care center doesn't say health care. So I still get mail because of the old name for nursing homes, child care centers. So when we changed the name, we did it for 2 reasons. We looked at what really said what we do, and we didn't want to just say medical because we're medical and dental, and that after that we've added mental health. So we wanted an umbrella with healthcare services, so if we added things. We didn't want center because if we ever had more than one location. So we tried to be as broad as we could with that, yet as descriptive as we could with that. And then the Hope name, I had a whole bunch of branding experts that came together and volunteers, and we all worked together, and we all had our names together, and we had all these cool names, and we were thinking of them, and finally somebody said, why don't we ask the patients? We asked the patients, and they said, you're Hope to us. I said, well, that's our name. If that's what we are, that's what we're going to be called. So that was great. In 2019, we had our first paid staff member. Before that, it was all volunteer practitioners. Again, I was obviously a paid staff member, but somebody actually seeing patients. I'll talk a little bit about that in a second. But one of the great breakthroughs there was that we were able now to really have students. which was always a vision of ours. Because with volunteers, we suggested to volunteers only volunteer 1 shift per month. Now, we've had some that do more than that, but we initially approached them with 1 shift per month. The reason was I would rather have somebody, and we've had people for 17 years, 1 shift per month, than burn somebody out after 6 months going, I can't do this. So if they want to do more, we encourage them to start less, add. Don't start running full speed. Let's make this a marathon and not a sprint. And that seems to have worked well for us. Our revenue, I'll just say this, we started, actually I've got a revenue slide, don't I? Ta-da, there's our breakdown of revenue last year. It's an all of the above approach, okay? Individuals is obviously the largest. Patient fees, we are not a free clinic. Now that is actually a little bit overstating it. And the reason I say that is because we work with radiology group, and also, labs, LabCorp that does our labs. But what happens is the patients pay us, and then they invoice us. So a lot of that's just pass through for sleep studies, MRIs, and labs. So that's not all revenue to us, but it counts as patient revenue. There's no other bucket to put it in. But it is, also a significant portion of our fees. We feel like in Indiana, we did expand Medicaid, but if you're below the poverty level in Indiana, you should be on the Medicaid program. And we will help you get on the Medicaid program. We tell them, listen, we've had people, we get them insurance and they cry. We're like, it's okay. It'll be all right. But if your appendix blows up, Hope Healthcare is not going to help you. You're going to go to the ER, you're going to get a huge bill, and they're going to chase you with bill collectors. You need insurance. So we're catching those people in the gap. The United Way did a study called ALICE, A-L-I-C-E. You can just Google that. And they'll break it down by county for the states that have participated with them. And that's asset limited, income constrained, and employed. Won't go into detail because you can find it all. Just go to the United Way and ALICE. So that's who we serve. So they're 1099 employees, maybe a woman cutting hair and renting a chair. It's seasonal employees. It's people that have just come off their parents' plan. It's there's as many different reasons as people that don't have insurance as there are people. But one of the number one things we found is family breakup. One of them had insurance and one of them didn't, and now they're not a family anymore. And we catch a lot of those folks, which we're grateful to do. But as you can see, again, we do get money from grants. Businesses, I don't want to throw businesses under the bus because businesses provide a lot of sponsorship for the events. So a lot of this can just be categorizing, okay? So yes, I could put them under business and you go, wow, you don't make any money at your event. Well, and we have one event a year, by the way. We have 2 hospitals in the county. I'll talk about them. We do get support from churches, and we rent space to 2 organizations. One of them is the Indiana Rural Health Association. What they do is they serve as a social worker for us. They wanted a space in the county. We rent them a room, so they help our patients sign up on Medicaid and also help with other social service organizations. So rather than bring on a social worker on staff, they do what they want to do, and they're getting rewarded, and we get a little bit of rent, but we're also fulfilling a need for our patients. So it's a win-win. In fact, a couple of our patients said, you're signing me up for insurance so I can't go to the clinic here. They referred me to you. Are they trying to get rid of me? We're like, no, we love you. This is about you, okay? We're trying to do what's best for you. So, but that's a great win-win. So that's a tremendous, a good thing. Yes?
And so you end up having this need. Do we have enough people who gain insurance? Do we start to participate with that insurer, and then that takes on more administrative burden, and then that's more of a
yeah. I mean, we've chosen not to, but the other thing we've done is some of our volunteer practitioners, we can refer them to them. You like Dr. So-and-so? He's got an office, you know? It's going to be, it's good. That's a great point. The other one we rent space to Our mental health counselors. There's a Christian mental health counseling agency. They were looking for a spot on the west side, so we rent them space in the building. They can see their own patients. They have a key to the building, but they'll see our patients at a reduced rate, and we further subsidize that rate. And it's great because as far as the patients know, they don't know that it's not a part of Hope Healthcare. They don't have a separate sign. They do have a separate entrance, but that allows us to have mental health services without having bring it on as staff. So again, another win-win. They appreciate the business, and we appreciate the fact of having that service available for our patients. So a great partnership there that we've been able to do. And so that provides our rent. So it's much more than rent, believe me. The rent is very subsidized. Yes?
How did you find them? Did they come to you, or did you go to them?
A little of both. Just networking in the community. I don't remember exactly how some of it. In fact, I think it was a clinical services manager that brought the idea to me. And so I'm not sure what the story was when he found them. But that's a great question. I don't know the answer. The counseling agency was Christian, and the woman that works at the IRHA is a Christian as well. I don't know that we could have dictated that to the IRHA. The other thing I like about the counseling agency, they have other locations, so they just use us. There's only one room, so one person at a time, but there's 4 different counselors, which gives a variety of people that the patients can choose from, including a man and a choice of 3 different women. So, you've got both of those, which is fantastic. We also have another counselor who lives just down the street from us and works out of her home, and we work with her as well. And we let the patients choose who they want. We don't dictate to that all. She also does tutoring, and so it's another great service we can offer without, again, bringing it in-house.
You may gotta cover this somewhere else, but can you tell me how many paid staff you have currently?
Yes, I'll get to that in a second, but no, great. We are, actually, that's the next thing, so we'll do that. People. Every organization needs money and people. If you're a nonprofit, get used to that. And the number one criteria I have for anyone in the organization is passion for the mission. That's number one. Everything else is secondary. Not that those things aren't important, but that they're not as important. So one of your first are your board of directors. One of the things the board of directors will help you do is expand your network. So you want to be a little strategic in who you bring on the board. We serve pretty much our county. Although we have no geographic restrictions. Our only criteria to be a patient is no insurance. No Medicare, no Medicaid, no VA, no private medical, no private dental. We have a few exceptions. If you're Medicare Part A only, that's hospitalization only, we'll see you. Because in my mind, you're not insured for primary care. If you have Medicaid Part E only, that's emergency room only. We're trying to keep people out of the emergency room for primary care. We will see you. And if you're on a health share ministry, if you've ever signed up for one of those, 14 times in the document it says this is not insurance. Well, if it's not insurance, you're uninsured. So we will see people on a health share ministry. Again, we could change that criteria, but that's where we're at. Somebody raise their hand. Yes?
Do you have an upper limit of income?
We do not. We do not. I mean, it's the resources to actually check that. And so many people could, husband and wife, they file separately and they bring in the woman's, or we asked for paychecks for a while where they bring the one who's uninsured, and we just didn't play the game. I mean, but not that it's a game. We just didn't have the resources to. We'd love to have the resources to have somebody financially checking them in and checking all that out. Excuse me. Volunteers, which of course our board are volunteers. This is something unusual we do, and it's been discussed many times. We have a statement of faith for our board, our volunteers, and our staff. Everybody. That's caused some opposition, which has already been talked about today, and probably some more, but that's the route we chose. Again, I'm not telling you what to do, nor am I telling you you're doing it wrong if you're not doing that. By any stretch of the imagination, that's something that we've chosen to do. That's making some hard conversations. That makes it hard for me to go to the hospital and recruit, because someone who wants to volunteer, I have to go, not always pretty. The other thing is, people take time. As executive director, people will take your time, and that's not a bad thing. I'm just telling you a fact. We have a couple of volunteers. They'll come in. And they're volunteers, so they're coming after their shift at work. I generally work 8 to 5. So if I'm leaving at 5 o'clock and a volunteer comes in that I know likes to talk for an hour, I get ready to I get ready to listen for an hour. I don't talk much with these particular volunteers. I'm just letting you know how it is. But you know what? That's time well spent. Or I've got somebody, I learned this from my boss at Duke Energy. He was a Jew not by faith, but by heritage. And but I sat right outside his office in a cubicle, and he had an open door. And I saw him get interrupted all day. And I thought, how does he get any work done? How does he do that? And he did. He was a very productive individual. But I learned that, and I took that with me when I left. And I have an open door policy, and staff will still come in. I don't want to bother you. Correct them every time. You are not bothering me. You are not, if there's some reason you need to walk through that door, you walk. The door's open. You are not bothering me. And so we try to get that out of their head, but people take time, and they do interrupt. But read the Gospels. I mean, Jesus' ministry was constantly being interrupted, and look how he handled it. And those were some of the greatest opportunities that he had in ministry that are recorded, were the interruptions. So don't miss those either. The other thing I'll tell you is people want to help. They want to help. When we converted a laundromat and tan into a medical dental clinic, construction workers came out of the woodwork. Think about this. It was 2008, 2009. What happened to 2008? I didn't see a stick go up out of the ground off of a foundation for 5 years in Indiana. Nowhere. They were all unemployed. They were just newly unemployed, and we were going to renovate a building, and they all showed up every day like they worked for me. Unbelievable what happened. Now, you know, God can work it all together for good. And believe me, those people were suffering. I don't take that for granted. But I also had no control over them. And I didn't tell them to come. And they showed up. And I know nothing about construction. I'm left-handed, and I can't drive a straight nail. I think it's something about the curvature of the earth and all that kind of stuff with left-handed people. But it's, I know nothing about that. And so, but they wanted, you know what? They're not doctors. They're not dentists. But you know what they want to do? They wanted to help a medical clinic start. So we let them, and we encouraged them. You also, I'll say, is you'll have volunteers for a season of their life. Now, we've had some that predate me, and they've been there 17 years, and we're going to honor them this year, 18 years, really. And but I'll give you, we lost 3 medical doctors, all women, when they had their 3rd child. Volunteered through the first 2, got to the 3rd one. Now, my wife and I have 3 children, and I completely understand. It is not the 3rd child that does it. It's now the oldest one is in t-ball and ballet and gymnastics and soccer and after-school activities. It's the darn first one. The 3rd one's still just a piece of furniture, okay? I mean, so I understand I understood. So they leave with your blessing. We lost 2 of them because one became a missionary in Africa and one became a missionary in Laos. Don't you dare go help those people. I mean, are you kidding me? What's wrong with you? So, you know, but you get them for a season and rejoice in that and love those volunteers. That's so great. All right, staff. Here's a picture of what I call, I just went through those, great. We went from 1, me, to 11. The other thing I'll say is the expression slow to hire, quick to fire. I've heard people don't say that. I believe in that because I've learned it, okay? I paid the price when I didn't fire somebody quickly enough, and you know what? It was better for both of us. And I've also been quick to hire. The 2 worst hires I ever made was when my first candidate didn't accept the job, took something else, whatever. And now I'm like, and so we've already been a long time, and we've been through this whole process, and I don't have an employee, so I gotta hire somebody. We'll take the second choice. Huge mistake. Huge mistake. Had to fire both of them at some point. One I did slowly, the second one I did quickly. And again, not fun. I'm not rejoicing in this. I'm just trying to give you some information and the benefit of my experience if it helps at all. That's our W-2 staff. And they're around here. So that's obviously at a little Christmas party, but we have great staff. Now, so we have actually now 6 W-2 employees, 2 full-time staff. This is a pharmacist. Myself are the 2 full-time employees, clinical services assistant and bookkeeper, my assistant. We have one other that has since added to the staff, and then we've got 4 1099s. We have 2 nurse practitioners, each 1 day a week. We have 2 dentists, each 1 day a week. And so we've got, and then we do have a dental assistant as well that comes 1 day a week. Let's see. I don't know what the next slide is. Oops, miracles. We could talk about that. What's that?
How frequently? How many days a week are you seeing?
We see patients 5 days a week and some evenings. So lots of hours, actually. And I can go over some of that. That's a great question, though. So we got 2 full-time, 9 part-time. One of the first people I hired, she came to me and she said, she was our first clinical services manager, and she said, in 9 months I'm leaving because my husband's retiring. She was the right person. I'd rather have the right person with passion for the mission for 9 months than have somebody else in another situation. Had the same thing happen with our first staff dentist. She came to us and she said, she came during COVID. Her husband lost his job during COVID. He was going into real estate. Takes a while to ramp that up. She said, I'm going to be here for 6 months while he ramps up, and I'm leaving you. I said, hired. You're the right person. I don't care how long I have you. You've told me that in advance. So I'll take the right person even for a short period of time. Yes?
And forgive me, just another quick question.
You're fine.
So you've got yourself as the executive director, and then you've got a finance person.
Bookkeeper, administrative assistant to myself. She's 15 hours a week. 3 clinical services assistants.
Okay, is that like a MA? Medical assistant?
None of them are MA trained. They're, no. But they schedule patients, check patients in and out. So it's 2 full-time. We have a pharmacist who's director of clinical services, myself as executive director, the bookkeeper, 3 clinical services assistants, 2 nurse practitioners, each 1 day a week, 2 dentists 1 day a week, and a dental assistant. Is that 11? I'm a math major. I'm just not good at counting. Let's see. Great questions, by the way. You're not interrupting. This is an open door policy here. I just do want to get as much as I can, and questions are good, believe me. It's a miracle how we got our building. Maybe I don't know how many these stories I can tell you, but maybe I'll tell you this one. When we went after the building, it was in foreclosure. It was a laundromat in Tan, and when we approached them on buying it, and they ignored us. First of all, we had no money. Okay, so I don't know why the bank didn't want us to buy it, but we had no prospects of getting any money. So, but we were convinced that God wanted us to have this building. So, great location, super building. It's really a fantastic building. So anyway, so I was trying to deal with the bank and the real estate agent, and I mean, we just had done everything we could do. I remember driving to the bank and to talk to them and sitting in the lobby, and they wouldn't see me. Sat there an hour and finally left, and I went and I laid hands on the building. Okay, now I'm from a Catholic background. Okay, you don't do that. Okay, so and in fact, well, anyway, I mean, so I'm so bold. I went around though, and I did it in the back of the building. Okay, so so after I was so bold, So anyway, they sold the building, okay? They called us, they said, listen, we sold the building, they're closing in 2 weeks. And I could not stop smiling. Honest to goodness, I don't know how to explain this to you. I could not stop smiling. And I said out loud, I said, God, I can't wait to see how you're going to get us this building. And so I went, and again, I didn't work in the building, the old building, so I went to the old building and I said, hey, I just found out the building we've been trying to get has been sold. We're going to pray right now and thank God for giving us that building. And they said, what? We're going to do what? I said, here what we're going to do. We are going to thank God that he gave us that building. They said, what was the first part? It closed and somebody else bought the building. And I don't know how to explain it to you because I've not done this a lot in my life. But we sat down and we prayed, and we just looked at Mark 11:24, and it said, when you pray, believe that you have received it, past tense, and it shall be granted to you, future tense. When you pray, present tense, believe that you have received it, past tense, and it shall be granted to you, future tense. So I said, we're going to thank God. I pulled out that verse. I said, we're going to thank God right now that God gave us that building. Well, 4 weeks later, my phone rang. And the two guys that bought the building, when they went to closing, found a lot about each other's finances that they didn't know. And one of them ended up with the business, and one of them ended up with the building. And he had no business. And somebody who knew somebody who knew somebody said, you know who was looking to buy that building? It was Hope Healthcare. And we bought the building for what he had in it. And again, I don't do that a lot. I've never had that feeling a lot. I've never had that prompting a lot. But that's a miracle. You know, I didn't do that. How did I do that? Tell me, okay? I'll do it again. I was telling Montana and Haley before you came in, our clinical services manager is a tough job. They ran everything in the clinic. And so when a nurse left who was in that position, we went out and we thought the job was just too much for one person. So we hoped to go out and we advertised for 2 LPNs. We're going to split the job up, job share it. We could just get an LPN because again, we're low budget. Okay, so we go out for 2 LPNs, and a gentleman finds out about it secondhand somehow. He comes to apply. I get his resume. He's an MD. Now, he didn't get residency. So he's an MD, but he doesn't have a license, and he can't practice and see patients. So he's my clinical services manager. So I prayed for 2,500 square feet, and I got a 4,000 square foot building that we own. I prayed for 2 LPNs, please God, and he brought me an MD. I don't know, but he's good. I know that. See, I don't know how to perfectly run a small charitable clinic, but we serve a perfect God and a perfect Savior who does know how to do it. And I just try to get out of the way. And I don't always do that. I've made a ton of mistakes. We've had some lean times. Give us this day our daily bread was many times our prayer. Well, the checking account got to less than $20 sometimes. I used to know when the United Way checks would come in. And in Indiana, you're not allowed to be a United Way agency getting money from the general funds if you're a health clinic. That's just a rule. Nothing about Christian or anything like that. But some donors can designate you, and some have done that. And I used to know when that would come in, just guessing, again, because there's no real schedule. But I don't know that we ever bounced a check. But man, some days it was give us this day our daily bread. And you've heard stories, and maybe you'll hear some more, but just some lean times. We had a gentleman, facility volunteers. Yes? Ever have what? We have had students. Once we had full-time staff, we were able to have students. For a while, we were a Butler rotation site for their pharmacy students. We have our first nurse practitioner hire, who's still with us in 2019. She is the assistant dean of nursing at Indiana Wesleyan University. So she brings students, and she said it was hard to find a gig that was 1 day a week. Most people wanted 2 or 3 days from you, and she really wanted the 1 day because they want her to have clinical experience, maintain that, but yet she's at the college as the assistant dean and teaching. So we got her, which is fantastic. So that's brought more students in. Another gentleman walked through our door. He's now an adjunct professor at Marion University School of Medicine. So he brings students. We have a relationship with Avon High School, our local high school, where they send us a student that's interested in healthcare now every month or every semester. So it was our goal for a long time to have regular staff, 8-hour days where we could involve students. But we didn't really have that much at all before when we were all volunteer clinic. So, sorry, just looking at the watch here. Our HVAC system, you know, we knew our building was built in 2000. You know, you figure out how long the HVAC system. I'm thinking that thing's failing. Again, this is the guy that doesn't know how to do, I can change the filter. And so a guy walks through our door, and he retired railroad guy who could fix anything. He's got our furnaces running better than ever. So we didn't have to replace those. One guy walked through your door, saved us tens of thousands of dollars. Our IT work has always been done by a volunteer. And he has done all of our low voltage work, security work, our phone systems, our hardware, our software, our servers. And when he goes out to his paying customers, when he's putting a new server in, he says, "What are you doing with the old server? What are you doing with your old people?" And we've continually had really good equipment because these are huge companies that have big servers, and we don't need a big server. So they've provided all of our IT work and all of our low voltage work and all of our phone work for free. Okay, incredible. I always say he could be named the Volunteer of the Year every year, because if you don't have IT and phone systems, you're not in business. I mean, come on. We had another gentleman I just talked about who was the adjunct professor at Marion University School of Medicine. He came through our door. He ran a 14-location FQHC in Ohio, and he moved to Indianapolis, or our area actually in the county, to be closer to his grandkids when he retired. So he asked his church, "Hey, is there a clinic around here?" Like, kind of describing us, I guess, and he showed up at our door. When he showed up at our door, I told our clinical manager, I said, "Do not get him out of here without putting him on the schedule," because I could just tell he wasn't going to go fish. He was going to do something. He was going to land somewhere. So now not only he's a nephrologist, but he sees our most difficult patients. He's 50 years in medicine. He's seen everything. He's the collaborative partner for our 2 nurse practitioners. He's our medical director, and he's on our board. But he thrives and loves that. I mean, if we told him to stop, it would kill him, literally. So it was but a miracle. What did we have to do with that? Nothing. God brought that person to us, and boy, has it been fantastic. And then COVID, the only thing I'll tell you about COVID, we did not shut one day. Not one day. Now, we had to make a lot of changes, but that's the past, you know. Hopefully, I'm not going to tell you how to deal with the next pandemic, because who knows. But that was our medical director, and then donors. The only thing I can tell you, without, again, breaching some confidentiality, we had an $11 an hour employee, I know a person that was making $11 an hour, let's put it that way, has donated $530,000 to the clinic. No lottery, no inheritance involved. I don't know how to explain that to you, but just, and so many people talked last night at a session we were at on the miracle that happened with maybe a large donor. I'm telling you, it was amazing. I sent an email to our board, and they didn't believe me. But yeah, it happened. So that was a good thing. Community support. If you have a community foundation, get to know your community foundation. Just good networking. Every county in Indiana has a community foundation. Churches, meet the local churches. Have them come in. Have them tour. You know, they can be of value in a number of different ways. The hospitals, we have 2 hospitals in our county. Both are involved with us. One, I'll talk about more in a second because I'm getting on time here. But one we've had a good relationship with. One has been a struggle. Now, the one that's been a struggle, I have been persisting for years, and we just, I think, had a breakthrough. I'm going to meet with their CEO, who's new, next month. And before that, honestly, they kind of ignored us. Now, they ignored us from a money standpoint and from any information standpoint. However, in their Epic system, their social workers download information to a spot in the Epic system, and our people go in and pull all their medical data, and then we follow up and have the patients come to us. So they trust us with the patients, they just don't trust us with the money. But they'll let us see all the patients, so I think we've broken through, which is great. So, but again, we've got a great relationship with their social workers. Again, we can pull the data right out. And they have got a couple of great volunteers that work with us. Your donors, again, we're a local agency serving local people in a local area. So most of our funding comes from local areas. I'm not saying don't try to find out, Bill Gates and Bezos' wife, what's her name? I don't remember, But, and I'm not saying don't try that. I'm just saying, I know our local service clubs. I'm talking about Rotaries and Kiwanis, local sororities, all of which have donated to us and done some great things. Network. We're part of 4 chambers of commerce, other ministries, other clinics, other executive directors. I've learned from all of them, visited most of them. And, I mentioned I went to Matthew 25 many years ago. Your local press. I know there's maybe not a lot of newspapers left, but if there's a print, radio, TV, any of them, it all helps. Certainly helps get the word out. Partners. Not all donors are partners. Again, both hospitals donate to us, but one of them donates at a lower level than the other one. To give you an idea, the Kingsway Christian Church, again, is a partner. What I mean by that is there were a couple times where they provided a backstop for us for financial. So we could meet payroll one or 2 times. So we've since paid that back, but they founded the clinic, and they've maintained a good partnership. Again, actually, our legal name is still Kingsway Community Care Center. We just did a DBA because I didn't want to go through the 501c3 thing again. So if you understand that. But they've been a great partner. They maintain a great relationship. They're still an active donor. And we're regularly in their budget, as we are with several churches. Others do special offerings for us. The IU Health West Hospital, they started about the same time we did, and they're in the county. We've been through 4 or 5 different CEOs, and I've got to know every one of them. And they have been fantastic. They are partners. We meet quarterly with their CEO, their CMO, and their CNO, their Chief Nursing Officer. And here's the meeting agenda. They lean forward and they look at us and they say, how's it going and what do you need? That's a partner. They give us money and they don't ask for any accountability. They trust us. Patients or visits? Patients, a year about 900 to 1,000. 2,400, say, visits, 2,500. Medical, dental, and mental health. We're pretty much the medical home for people. We try to be. Obviously, some are transient, or some we help them get insurance. But yeah, we're pretty much that medical home in servicing them that way. No, good question. Where am I at? Oh, I already talked about the Indiana Rural Health Association, a partnership. They're in the building providing social work. 2 Christian counseling agencies in the building providing services. Now again, we pay the Christian counselors. We subsidize the rate, but the patient pays some. Keep learning. That's the other thing. There's a fundraising school. We have it in Indianapolis, largest one in the world, the Indiana School of Philanthropy. They do classes remotely. They do them regionally. I'm not saying these are things you should do or have to do. I'm just saying these are examples. We have something called Leadership Hendricks County, which were leadership classes, which also integrated you into the community. I went through Leadership Hendricks County one year, and coincidentally, both brand new CEOs of each of the 2 hospitals happened to be in my class. God is so good. Now, how did I arrange that? Of course I didn't. The National Association of Free and Charitable Clinics is out there. If you had to choose between that and CCHF, choose this one. But we have found benefit with them. Great organization. The Church Health Center in Memphis holds things called replication seminars. I know that some are going next week, right? We went to that very early in my career. I didn't even know they were still having them, but we had the conversation last night, but that's fantastic. And then visiting other clinics. Yes? On NAFC or CCHF?
Yeah, we're members of that.
Okay.
But for CCHF. So how do I?
It's a similar structure.
Yeah, how do I
based
go
on your
back
budget.
to my board? So now we've got different memberships in both. That's a significant membership.
We were not NAFC for a long time. and for that same reason. And so, eventually we did join. I mean, they gave us our EMR for free.
Well, CCHF is what I was.
No, I know what you're saying. Yeah, I mean, I've just found great value. I mean, it paid for itself many times over. I completely understand those. Yeah, no, those tough decisions, I agree with you. It's hard. I've only gone to one conference on NAFC because it was in Indianapolis. And I slept in my bed, and we split it. I sent one person one day, and I went the other day. So I get that, okay? I'm right with you. Yeah, it's a choice, and it's hard. But NAFC, the other thing I like about what they did, they have the rating system, which helps you rate yourself. And we've got gold rating every year, and we're proud of that. But that also helped us do a self-evaluation every year, which has been very, very valuable. Yes. Yes, fundraising as well. Yeah, you're right. Yep, no, great. Another resource, TechSoup.org. If you don't know about TechSoup.org, TechSoup.org. Hardware, software at a very reduced rate. Pennies on the dollar, 10% of the market rate. And I'm sure we could share other resources. Somebody else had a hand up.
Would you mind sharing your rough annual budget?
Right now it's $500,000. Now, we also talk about, we have a surplus. We've been banking some of that money that this large donor gave because they're not going to give forever. And they've made that clear as well. Now, I know that you're saying, how in the world do I know that guy? In 1985, they filmed the movie Hoosiers, and that's me on the right. I look more like the guy on the left now, but if you've ever seen the movie Hoosiers, I am number 55 of the Verdi Hornets. So here I is, guarding what was Dennis Hopper's son, actually. One other point about Hoosiers. I had tickets to the premiere, and I didn't go because that was the day I became a father. During the time the movie was being shown downtown Indianapolis. So on November 10th, 1986, I will remember that date forever, is when the movie premiered because I was busy. And that's my contact information. I am certainly willing to answer questions, and I'll stick around here if you want to. Yes, you had a question.
Yeah, so I've just recently taken the role of CEO, but I've noticed a pretty significant trend in our overlap of donors and volunteers.
Yes.
And I've been looking at that. It looks like other people see that as well. I'm just
Yes.
wondering how you guys manage that. We also have volunteers, but it's like less and less of our services are being done by volunteers over time.
Yes.
I don't want to lose that relationship.
True.
That was coming. So I'm wondering how you manage that or how about that.
I mean, you obviously want to keep as many of those relationships as you can, but I think that's an evolution of a clinic. You start with a board that probably is doing most of the work even. Ours was started by a doctor who was doing most of the work, and a dentist who was recruiting and helping all the dentists. And so, and it was the pastor of the church that started it, and it was the treasurer of the church that was running the book. So it was very much of a hands-on board. And then the board, I think, yeah, and it evolves to becomes they're not doing the work. Now more volunteers are doing the work, and they begin to hire staff who aren't necessarily seeing patients like myself, but are coordinating the work. Then it goes to now where we've gotten some paid staff, the nurse practitioners and the dentists. And one thing I will say about dentistry, by the way, dentistry is expensive, it's complicated, and it's hard. Okay, and we're not going through a crisis with dentistry, but we've got a little pause in our dentistry right now. One of our dentists left. He's in practice with his father. His father retired. He's now got a full practice to watch. I've got another dentist who's getting ready to leave us on May 17th. He was accepted to endodontic school. So they leave us for good reasons. So we want to keep in contact with those folks as well. But yes, we kind of migrate to some paid staff now in positions where it was done all by volunteers. And man, I always compare my job to a plate spinner, and you have to be old to know what a plate spinner is. But yeah, it's hard to keep 10 plates spinning at once, and sometimes some of them hit the ground. But yeah, you do the best you can to develop relationships. People and relationships are everything, that's for sure.
So to follow up, do you actually ask your volunteers to be donors?
Yes, that is a great point, and the answer is yes. Remember I said people want to help? They've invested more valuable than money, their time. They will give money. They want to give money.
Don't be afraid to ask.
Absolutely, that's a great point.
Don't think that they won't
Yeah, or yes. Or we're going to offend them and they're going to leave. Yes. Yes, your volunteers should be donors. It should at least be asked. No, that's a great point. Yes.
What have you found as being the kind of the big difference between being a charitable clinic where you charge a fee versus being a free clinic? And have you had those discussions and tried to figure out what is that right balance? And what do you do with people who don't have any money to pay?
Great, all good questions. Yes, I think we've had that tension. We're again, in Indiana, if you're below the poverty level, you should be on Medicaid. So these people are doing something to keep themselves out of poverty. So they're working, they're self-employed, they're seasonal workers, they're between jobs, but or maybe their family broke up, but they have some measure that's keeping them above poverty. So they do have some money. And our no-show rate down when we charged, we started kind of as a free clinic before my time. People put a value on the service. And they also need to know that healthcare is not free. And we've not really had much pushback. We do have what we call a grace fund for people that truly can't pay, but we don't put that out on the shingle, okay? Because if you say pay only if you can, they can't. Hey, I like your new Audi. Don't have $30, huh? So, it's a balance. But again, we're dealing with people that generally are working. So although we have provision for that, it's more of really they come to us and they really explain maybe a hardship case or whatever. And yes, we will help them and have provision for that. And we've got even a kind of a series of things. They at least fill out a piece of paper, tell us what your situation is, and then we put a limit on it for how much in a year you can draw from that fund, those kind of things. And we don't care whether you use it for an MRI or you want to use it for labs or whatever. But no, we've not had a problem charging. It's because, again, we're not dealing with people below the poverty level. You all are great, and you ask good questions, and I know I'm over time. No, I appreciate CCHF so much. I know I started with that, but I'm going to say the same thing. And when I proposed this title, they even took the title, which I couldn't believe. But what the heck? They had a sense of humor. But yeah, I've been blessed with just, again, great staff, but also, great mentors here at CCHF. Many of my heroes are right here at CCHF, and I say that so sincerely. I'm just amazed at the folks here and what they've done and what they've been able to accomplish. So, but again, you've got my contact info. That's our website, my email, phone number. Feel free to call, and thank you. You know what? Let's pray. How about that? God, again, we are grateful for another day of life, for the way you continue to meet our needs as families, as individuals, as clinics, and as an organization. God, we continue to look to you for all things and know that all good and perfect things come from you. God, we are grateful to be involved in a ministry that exalts you and glorifies your name and stands with you at the forefront and the center. God, again, may we live our lives in gratitude for all that you've done for us, but most of all for Christ and his sacrifice. And it's in his name that we pray. Amen.